Hey guys, this is Dr. Ghalambor from Nortex Spine Joint Institute. We want to talk about PRP. So PRP is the holy grail of regenerative medicine. The idea is to get something from your own body and put it where the body is failing to heal itself and give it a little push. So we have plenty of healing power in the blood. And the number one source of regenerative medicine where we get stuff is your own blood, because you can infinitely make more blood and blood and blood versus other areas such as the bone marrow. When we get the stem cells, you cannot make more of it anymore. So I would say in my practice, 95% of the regenerative medicine treatments that we do are PRP. So what is PRP? It's platelet-rich plasma, but it's a little bit of a misnomer because platelets are not the only component of the blood that would create the regeneration. There's platelets, yes, but there's enzymes, there's proteins, there's cells like macrophages, and all of that basically healing mixture in addition to the platelets will do the trick, which is go to an area of your body that is failing to heal itself because maybe there's not enough blood supply, such as the tendons, ligaments, disc, labrum, meniscus. These are structures that naturally don't have vascular supplies. There's no blood going there. So there's no healing supplies and no construction workers or materials being delivered to the site. So what we're doing, we're cheating the nature. We're getting where we have plenty of these in the blood and deliver them where they're scarce, and that would help the healing process to happen faster and more effectively. So how do we do a PRP? What exactly is involved in the PRP injection process? This is a PRP kit. This is Apex Biologic. This is one of many companies that are available. In fact, we use more than one company. Each of them has pros and cons, but in this particular case, I'm using the Apex Biologics. We open it up. First thing we see is heparin. Heparin is a medication that when added to the blood will prevent it from clotting, because definitely we don't want to get your blood and have it clotted. That would mess up with the spinning process. So this is an anticoagulant, and here we have the kit. So this is like I said, one of the many kits that we use. In the kit we have what we need to draw blood. So first thing that happens is that we will do the blood, get the anticoagulant so the blood doesn't coagulate, and we'll be getting a total of 60 cc's of blood. There's a couple of kits, like I said. There's a 30 cc, there's a 60 cc. Sometimes we use two of these to total of 120 cc's of blood, depending on the condition. Once we have that 60 cc's, we will then inject it in this vial. This vial will go here into the centrifuge. Once the spinning is done, typically we will have about 50% of red blood cells, so we don't want them. We will have basically water that we're squeezing out of the plasma, and then we have the concentrated plasma. How do we get this? We use this bench top, we dial it back down, so we have total control over what part of the blood we're getting out. So PRP, in effect, we can also call it a concentrated plasma. So what we're doing here with your blood is that we're getting the red blood cells out of it, we're getting the water out of the plasma, and we're injecting a very concentrated plasma. How much? Typically, out of 60 cc of your blood, we will get 5 to 6 ml of good quality PRP. Once we get the PRP, number one, we want to make sure we're doing it the right way. We get a good concentrated amount of your plasma full of platelets and enzymes and macrophages and other good stuff. That is important, but even more important is to do the intervention under image guidance. So here we have a Sonosite, which is one of the best ultrasound machines. Typically we want to use either ultrasound or x-ray because the medicine needs to end up exactly where the pathology is. We know where the problem is typically beforehand. Either we've used ultrasound or we had an MRI that shows where exactly the problem is, and we want to use imaging to make sure that this healing power gets delivered where it needs to be. Now, what about other treatments? Why don't I just do a cortisone shot? Well, it depends. Some conditions respond beautifully to cortisone shots. The problem is cortisone is a strong anti-inflammatory, will get the inflammation down, but if your body's unable to use that opportunity and to finish the healing, once the cortisone wears off, the problem will come back. So if you've had a couple of cortisone injections already in one area and you get short-term relief, you need to stop, because repeated injections of cortisone in any given area have shown to actually make the problem worse. What we want to do is that, okay, it's reasonable to try once or twice, no long-term relief, stop. because clearly that is not what we want to do with the structure, because that is not resulting in healing. This PRP technology is able to fix the problem once and for all. So if you have a problem that is not getting better with time, 2-3 weeks, you've tried anti-inflammatory medication, you've tried massage, you've tried chiropractic care, physical therapy, that is definitely the time. Any problem with spine and joint, after 2 months, PRP should be your #1 possible treatment modality you should be looking for.